Yes, it's fine.
Okay. For the translator, I will speak slowly because I summarize the the first presentation speaking. Okay, don't using slides because we cut a little bit of time. Okay. My good friend, today we are discussing about remote assistance, veterinary remote assistance. What means? I think many of you know these words. You know, is in a big continent as Africa, but also in remote area in Europe, in Italy too. It's not easy to have a direct contact between uh, animal health technician, meat inspector, or veterinarians and farmers or abattoir people. And for that one, um, you know better than me, the big revolution in Africa was the mobile. For that one, many colleagues, they started working on remote veterinary assistance. What means? Means is one activity where veterinarians or technicians, they are not physically present near the animal, near the abattoir or in the farm. This means the farmer in remote area, sometime in area where we have a stable situation, using the mobile, sometime using a specific app, some other time not, using WhatsApp. They send information to veterinarian slash technician. This is one opportunity that we have. Why? Because looking at the coverage of the mobile phone in the African context, there are remote area where we don't have a connection, but in many places of Africa, we have a connection. And many colleagues are using WhatsApp. And in many cases, we build up, we organize ourselves WhatsApp groups, means putting together our telephone number, deciding in which what we would like to do. And today we are focused our attention on photography, but also we can send information concerning clinical visit. We can send information concerning many data. Of course, because we are discussing about a free tool. WhatsApp is a free tool. We can send photos and information because also in some specific situation, and I was so lucky to design one specific app. We have a specific app that we can use, and this app can record many information. They can make georeferentiation of the farm. We can send in a specific form standardized information. We can send photos. We can have an opportunity to come back and looking at the situation. We have an history of this farm. Of course, these tools cost. For one remote assistance app, they need, because we have to ask specific company on that, they need 20, 30,000 euros. That is not so much. But of course, we need a sponsor for that. But concerning us in this moment, if I have doubts, after this presentation, a very good presentation, and we are focusing on abattoir, we are focusing on gross lesions. If we are in the abattoir, or if we are carrying on a post-mortem examination, and we have some doubts, we can use also WhatsApp to share information and photos between us. In this moment, in my mobile, I have 4 WhatsApp groups. 3 are linked, 3 are with the Libyan colleagues, and we share information, not only for CBPP, of course, because remote assistance, veterinary remote assistance, is now we are focusing the attention on CBPP, but of course we can use for many diseases. We can use for therapy. Remote assistance can be very good when we are discussing about antimicrobial resistance. Can be very good to give indication, information, the dose, the withdrawal time to the farmer or to the technician that are near the farmer, informing the correct approach of using antibiotics in the African context in remote area, in area where are no present veterinarians and technicians. This can be also a good opportunity. This can be a great opportunity to have a link between remote area and expert. Expert that should be not international one. We have a good expert, African expert in each country. We don't need international expert. Or we need when we have some bracket big doubts. It's important, sometimes to share some doubts or information with old people like me. But considering CBPP, you don't need this one because you have good colleagues around Africa. And also, I think you don't need international expert if you are speaking about therapy. But this should be another approach. Give information by WhatsApp to farmer is another way. Of course, you can say, Massimo, but in which way? Of course, we need a contact. All this story. I would like to repeat, thank you very much to the WOAH sub-regional office in Nairobi for this opportunity. But this story can be also a first step to try to use also this technology that we can say new, but is not new now. Now we are discussing about artificial intelligence, but to use this technology to try to control at a basic level the antimicrobial resistance, in my opinion, is fundamental one. All the study, all the research are focused on strain isolated in the hospital concerning human bacteria coming from humans who show antimicrobial resistance. Okay, but why is correlated with the therapy in humans, or is it correlated with the food of animal origin? For this, I think also we have to think about antimicrobial resistance. For this, we have to think all the world are speaking about one health, but also we need to be present in remote area to give information to farmers, because sometimes they don't know. they don't know the quantity, they don't know the dose, they don't know the withdrawal time. Remote assistance can help us. Now, concerning CBPP, I would like to focus my attention on photography. Because if we would like to ask support to other colleagues, we must speak the same language. And also photos is a language. For this, we need to take good photos concerning the CBPP. And what we can do in this case? First of all, for post-mortem, because also post-mortem is a part of this presentation, of course, we need to identify specific component of this activity. We need, of course, telepathology for lesion, for identification of lesion and confirmation. For this, we need visual record. We need photos on that. And of course, the link should be farmer or technicians and veterinarians, official veterinary services, diagnostic lab, where the farmers have to play a role. This is in my dream, of course. And to take good photo, we need a preparation. But we don't need a camera. We need only a mobile. Of course, we need to take photo if we are carrying on a post-mortem examination concerning no specific disease. We need to take photos of material who are around the carcass. Of course, we need to take photos of external examination, and we need to take photos of internal examination. This step 4 is link this presentation with abattoir control and using remote assistance in the abattoir. We need, if it's possible, to have some idea concerning which day is, because in many cases we forget. We have to identify, if it's possible, these photos, because in the future, if we would like to make a trace back, we can do this one, but we have to identify what we need. The best is a laminate label, but if we don't have a piece of paper that we can put near the organs, the paper, the big problem is the blood, because this piece of paper become very dirty. But if we have a good management of organs, we can do this one. First of all, is very, very important, one identification number that should be correlated. We are discussing about post-mortem examination for CBPP, could be correlated with the form that I presented to you just a few minutes ago. The form where I have to collect all the information. We for sure, we will have a number. We have to correlate this number of the form with the number of photo. One unique identification number. This is fundamental one, because as I said, Dr. Garoma just a few minutes ago, we need to take pictures, but we need also to collect information. And both we have to share with the official veterinary services. Only in this way we can do a great job. Only in this way we can do a gate job with the number and the date. This is very, very important. This is our, of course, is too much in some place. It's true that I have to make only one time, because if I use waterproof pen, I can remove the ink with the alcohol, and I can use this label 100 times. To put a plastified, a lamelate label like this one is not very complicated. But if we don't have, don't worry. We can use paper, or we can use a piece of plastic, white one, putting the number and the date. This is fundamental one. Of course, the quality of photos should be good, because also many of you are young, and if you made good photos, are a fundamental one for publication. Because if you publish, you assist. If you don't publish, for this exercise is for our work is to try to improve the diagnosis of CBPP and other diseases, and also to give information for antibiotic utilization. But it's also a good moment for you to grow up, to collect good photos that you can use for publication, but not only, also for carry-on training, because this is also one mandatory part of our activity. Not only make the diagnosis in the lab or in the field, but also to share the information that we have with our colleagues, with the farmers. For this is very, very important to take good pictures. And take good pictures means also to avoid to take pictures with the knife, with the very dirty background, with the visible gloves, hands. This is fundamental one. As Dr. Bastiansen said, we share this material with you. For this, you will have a clear idea what we have to avoid to take good pictures. Of course, could be good if we have one background that can be different color. But I know that is not easy. Will be more easy for people who are working in the National Veterinary Lab. Take in consideration, this can be also very, very important for us. Concerning us, all findings should be photographed, because including incidental or insignificant changes. Why? Because you share these photos with the people, expert people. They can give you advice on that. All the changes must be take photos. And also, when it's possible, we have to take photos in the border between pathological parenchyma and normal bracket parenchyma. This is very, very important. Yes?
Massimo, you know what I'm going to say?
Yeah?
You know what I'm going to say? You only have 5 minutes left, huh? And I see
have
that you have
5 minutes.
large number of pictures. So
yeah. In 5 minutes, I would like only to go directly to the photos. Of course, Patrick, we are not in a hurry, because we leave this material to you, and I put many information here. Means don't worry, you will have all the information here, and through Dr. Bastiansen or Viola, or directly, you can contact me when you like. Is only to show you that this is my procedure, starting from the carcass. I go directly, I skinning the carcass, and I take photos of that one. If you see the label, all the time is there to take what? In this case, is a sheep with hemorrhages, subcutaneous hemorrhages, or in this case with edema in the muscle of this horse. Muscle are you have to take photos, and after we have to take photos, opening the nose cavities. You see, in the nose cavities we can find, Estrusovis. These are parasitic worms that you know very well. Or the abdomen and the chest cavity. But give all the time information. This is a correct photo where I can see lung and the liver, in the abdomen, intestinal tract. And if you see with this intestinal tract, you see there is a clear lesion here. You see these hemorrhages on the serosa of intestine. This is a very, very important. We have to find if there is presence of exudate or trasudate, abdominal cavity, chest cavity. We have to collect. We can collect pleural fluid after we check. We take photos of chest cavity. Also, if there are no lesions. These are very important for CBPP. And we have to take photos of a single organ. Brain, if it's possible, because I know it's not easy to open one head. Heart, spleen. You see, in all these photos, there is identification number. Liver, and we try to avoid to leave here a knife, forceps, scissor. The photo is more or less clean. You see, lung, the background in this case is a plastic bag, a black plastic bag. Sorry, I go ahead. Of course, we need to take photos in one side, all the lung, all the liver. Don't take one piece. The first photos have to take all the organ in one side and the opposite side. Remember, only if we speak the same language we can understand each other. Please follow the indication of this procedure, of this presentation. Muscle, you see, in this case we have a necrotic muscle here. This is not a good photo because I don't have a photo of the entire, the full liver. And there is no possibility to understand. This is the pericardic sac. First, I take photo in one side, and after I take a photo cutting the pericardic sac. Also inside, and the separate one. And the separate one. Opening also dissected heart. Because we can find the lesion on the surface. This is a necrotic lesions, but also inside. Hemorrhages in epicardium and endocardium. Lung the same, and this is important for CBPP. One side, the opposite side. Please, you have to collect photos of all the lung. Also, the part of the lung there, they don't have lesions. Remember. Trachea, and the section. I think this is a not good photo. It's not possible for us to give you support. This is not a good photo, my friend. For this, it's important to take good pictures, clean. Of course, if you are in the field, it's not easy, but we have to do our best. If it's possible, we have to wash the organs if they are very dirty one. But we need to take good photos. Only in that way we can help you with hemorrhages, fasciola, and this is not a good photo. You see, it's not possible. Everything is dirty, and there is not possible to appreciate the lesion in this liver. Huh? I don't know if I can stop here because this was my message. Patrick, if we don't have a time, for me, it's okay. It's only because we know that we will share this presentation with our friends. I don't know. Let me know.